We'll get started momentarily. We're just trying to coordinate some schedules here, so bear with us for just a couple of minutes. Thank you. Okay, thank you for waiting for a couple minutes here with us. Good morning. Thank you for coming. My name is Chris Hansen. I'm the president of the American Cancer Society Cancer Action Network, and we are honored to be standing here today with the American Diabetes Association, the American Heart Association, the American Liver Association, the American Lung Association, Consumers Union, Cystic Fibrosis Foundation, GBS, CIDP Foundation International, Mediviver, National Multiple Sclerosis Society, National Organization of Rare Disorders, Pulmonary Hypertension Association, United Ostomy Associations of America, U.S. Hereditary Angioedema Association, and Women Heart. I mean, we've got the medical space pretty much covered here, the patient space pretty much covered. Collectively, we represent millions of patients and survivors across the country who would be adversely affected and impacted by the health care bill as currently being considered or is about to be considered in the Senate. The Senate's Better Care Reconciliation Act, which is inappropriately named, moves our nation's health care system in the wrong direction by increasing the number of uninsured and making health insurance coverage cost more for those who most need it. This bill, as proposed, is absolutely a step backwards. The Congressional Budget Office projects that if the latest version of the Senate health care bill is enacted, it will lead to 22 million more Americans losing health coverage under the current law. This bill opens the door to allow states to waive essential health benefits, that requirement, the essential health benefits requirement, which is a provision that's helped ensure millions of people have access to the kind of health coverage they most need, such as preventative screenings, prescription drug coverage. Eliminating essential health benefits will make it easier to discriminate against people with serious conditions by making health insurance prohibitively expensive for them. This bill also would subject patients, once again, to annual or lifetime caps on coverage. Patients who have treatments that exceed those caps would be forced to choose between saving their life and their life savings. The bill lowers the premium tax credits, eliminates cost-sharing subsidies that have helped to keep insurance coverage affordable for people. It also allows plans to charge older people more for their care, and these policy changes could price many low and middle income Americans out of the market, exactly what we don't want to do. Significant Medicaid cuts would eliminate the safety net coverage and could leave millions of the most vulnerable Americans without critical preventative and curative health care. As part of an omnibus survey that was conducted earlier this month, ACS CAN asked nearly 1,100 American adults a series of questions about their feelings on the proposed changes to these critical patient protections in the current healthcare law. The survey found that nearly 9 in 10 surveyed, actually 89%, oppose raising health insurance premiums for older Americans. 81% said they would oppose a Senate bill that includes deep cuts to Medicare, as this bill does. And more than 7 in 10, 71% to be precise, surveyed opposed moving to lump sum or per capita cap payments for the program when they found out that the increased funding may not be available to deal with real-time needs of state residents. Patients need a transparent, bipartisan effort to stabilize the insurance market, bring down premiums, and retain the patient protections that are so critical to those with serious diseases like cancer. Quality, affordable, available health coverage is critical for patients living with a serious illness. More than 60 patients have traveled to Washington, D.C. to share their personal stories and call on senators to protect patients now. Our groups urge the Senate to oppose this bill and go back to the drawing board and work together to find ways to protect patients with serious illnesses. Is Senator Bennet in the room? Oh, Senator Bennet, I'm sorry, I didn't see you. I am absolutely delighted that Senator Bennet from Colorado is joining us to share his perspective on healthcare negotiations and the importance of coverage for patients. Following Senator Bennet, we'll hear from patients who will illustrate the critical need for coverage that is affordable, accessible, and adequate, and easy to understand. Please welcome Senator Bennet from Colorado.
Thank you. I'd like to thank all of you for being here, and especially those of you that are either patients themselves or the advocates for patients who know that this is not about politics for people in this country. This is about having a healthcare system that actually works for people. And as many of you know, I come from a state, Colorado, the most beautiful state in the country, and it's a complicated state politically. It's a third Democratic, a third Republican, and a third independent. And I do town halls all over the state, just as I did when we were passing the Affordable Care Act to begin with. In many places back then where people were worried about what the Affordable Care Act would do, it has been absolutely astonishing to see people coming back to some of the same places where people oppose the Affordable Care Act most strongly, urging me to fight to make sure that we keep it. And that's not everybody. It's not everybody. And there is deep dissatisfaction with our healthcare system generally. A dissatisfaction as a parent I share. I said on the floor last night that a lot of people feel like the way they intersect with American healthcare is very difficult for themselves and their families. But that's not necessarily about the Affordable Care Act, which is only one part of what we do. It was an effort to expand coverage. It was an effort to make sure that people with pre-existing conditions, for instance, could get insurance, that people who had chronic illnesses didn't face lifetime caps that threw them off their insurance. That's what we were trying to do, and we may not have done it perfectly. And there certainly are places in Colorado where there is not enough competition for people's business with respect to insurance. It's absolutely true. But if I set out to design a bill less responsive to the critics of Obamacare in Colorado, much less the many people that support it, it would be impossible to write a bill less responsive than the House bill. It's a political document. It doesn't have to do with health care. It's not a health care bill. It has three components, and I'll say this, and then I'm going to turn it over to Matt, who actually knows what he's talking about. It has three components, none of which anybody in Colorado has asked me for. One component is a massive tax cut for the wealthiest Americans in this country. Now, you could have arguments about whether that's a good idea or a bad idea. It's going to do nothing to advance anybody's health care in my state at all. At all. It's actually, just for the 400 richest Americans, is $33 billion. That translates to, on average, to about $85 million over the next 10 years for those 400 people. That's equivalent to 720,000 Medicaid patients in just 4 states. We could have a debate about the merits of that, but it's not going to help people's health care. The second big component of the bill is a massive cut to Medicaid, which nobody in my state is advocating, especially during this opioid crisis. And people in rural parts of the state who depend on delivery of health care from rural hospitals know how difficult this is going to be for them. And that's why we need to fight it. And the idea that we're, on the one hand, cutting taxes massively for the richest people in America and paying for it by slashing Medicaid health care for poor people makes absolutely no sense to me or anybody that comes to my town halls. And then the final point I'll make is this. This is the third part of the bill, and it's the critique that Rand Paul has made, and I completely agree with his characterization when he calls it Obamacare light. That's what it is. That is the one part of the health care bill that is a health care bill. It's just a lousy health care bill. And if you hate Obamacare, believe me, you're going to hate Obamacare light. So as Chris said, what we need is a bipartisan effort to fill the holes that exist in our healthcare system, to make it more affordable, to make it more predictable, to make it more transparent, and to make sure that somebody who has a pre-existing condition is not denied coverage just because they have a pre-existing condition. None of us knows what health situations we're going to have in our lives, and we should design a healthcare system that anticipates that and doesn't just treat people as winners and losers, but actually takes care of all of us. And that's why it's so important that all of you guys are here today. And that's why it's so important that people call your senators and tell them, vote no on this nonsense, on this piece of legislation. And tell them while you're on the phone that Democrats and Republicans should work together to produce something that's better for the American people. And one of the people that's relied on the Affordable Care Act because of his own pre-existing condition is Matt Slaby, who's a small business owner from Denver, Colorado, who made the trip because he's concerned about what we're facing. And so let me introduce to you Matt. Thank you for all of your efforts, and thanks for having me today. Matt, come on up.
Thank you, Senator. I know what I'm talking about in as much as this is personal for me as it is for other people here in the room. And I'm looking at all the faces of people that share circumstances with me. So let me begin. My name is Matt Slaby. I'm from Denver, Colorado. I'm a small business owner. My company, like the light shining back at me right now, works in the area of media and production. I'm also one of millions of Americans with a pre-existing condition. 4 years ago, I spent a month in the ICU while doctors struggled to figure out why I was forming blood clots in my leg and across my lungs. They tried several different, less costly medications to stop the clots, but the drugs, they ultimately failed me. It was only after my 4th recurrence that they found a medication that worked. Look, I'm 38 years old. I'm only 38 years old. That means that I'll be on medications for the rest of my life. That also means that I will require insurance coverage for the rest of my life. Like most folks here, I'm just one uninsured reoccurrence away from losing my house, my business, my savings, and my assets. Facing this reality during my early 30s came as an uncomfortable awakening, and I think about it literally almost every day. Fortunately, my coverage through the Affordable Care Act has prevented this from happening and has ensured that I can continue contributing to society as a worker, as an entrepreneur, as a homeowner, and as a human being. In essence, the Affordable Care Act underpins my American dream. I've spent the last several years advocating for myself and for others like me. And here's what I know. This bill is not the answer. It leaves millions of people like me uninsured. It makes ordinary people pay more for less coverage. And it strips Americans of basic health care services. My fear is that this bill caps coverage, any bill that caps coverage, prices people like me out of the marketplace. I'm afraid of this because that is exactly what this bill does. That's exactly what this bill does. I'm here today to urge senators to stand up for patients, consumers, and people like me in opposing this bill. Thank you.
Thank you, Matt. We agree with every word you said. And now I am honored to be able to introduce Senator John Tester of Montana. Senator, thank you for joining us.
Thank you for being here. I would like to say it's great having you all here, but the truth is we're dealing with a health care bill that's a wreck. And so thank you for being here, making sure your voices are heard. Lynn St. Clair, thank you very much for being here from the great city of Livingston, Montana. So thank you. Look, and the gentleman from Colorado, thank you. 38 years old, you're right, you're young. You got a long life ahead of you. We got to be aware of this stuff. You know, we're a state of 1 million people in Montana. This bill is going to wipe out Medicaid expansion. We have Medicaid expansion in the state. It's been in effect for about almost 18 months now. And it's going to wipe 77,000 people off the rolls. Just take them off the rolls. Not that these people aren't going to still get sick. It's not that they aren't going to still need medical treatment. It's just that they're not going to have access to it now. And if they do have access, it'll increase charity care. And nobody likes to have anything called charity associated with their name. And what will happen when you have charity care in many of the small communities in our state is those hospitals who can't afford to have that charity care go up will either have to change the way they deliver their medical treatment or they will have to close up. A huge problem. If you come from a small town like I do, if you lose the hospital, the town's gone. I mean, there's no hope for it. That's what this health care bill is about to do. Pre-existing conditions, saddle up. We're going back to 10 years ago. Lifetime caps where people pay into an insurance policy for their entire lifetime, get sick, and when they need it most, could hit a cap and have the insurance companies kick them off. Look, it's been said before, the ACA is not perfect, and it could use some amendment. But to replace it with this bill is about the most irresponsible thing I've ever seen since the 10 years that I've been in the United States Senate. To have a bill that was done in a back room with a limited number of people to give input with probably a lot of cigars and steak and whiskey involved is a bunch of garbage. We should have had a full committee process so that people like you could have had opportunity to put your input in so we could create a bill that worked for America. I hope this bill never sees the light of the Senate floor because, quite frankly, it doesn't deserve it. But in the meantime, I would just say this. The only way we will change the way this body works, the United States Senate, the greatest deliberative body in the world, is by you. By you standing up and telling your stories. And if it's not your story, it might be your neighbor's story or your cousin's story. Because everybody is affected by health care. This is 1/6 of the economy. If we screw it up, the damage that will be done will not be able to be fixed a year or 2 or 3 or 4 or 5 from now. So I would just say thank you all for being here. We've got a lot of work to do this week. This is probably the most important week since I've been here, and we've dealt with some very, very weighty issues in the United States Senate. But this bill could have long-term impacts that are some of those impacts will be irreversible. So thank you for being here. Special thanks to Lynn for being here and making the trek. I know what that trek is coming from Montana. If you get lucky and get to go through Minneapolis, it's 2,000-mile legs. If you have to go through Salt Lake or Denver, God bless those two towns, but it's a lot further from Montana, okay? But I just do want to say thank you very much. It truly is a time where the American people need to stand up and say no. God bless you all.
Senator, thank you very much for those words of wisdom. Now we have two more patients that have stories that relate to what this bill actually means. And the first one that I'm going to introduce, who will speak as soon as I stop, is Lori Burgess-Jett from Ohio. She's going to share her story of Medicaid expansion saving her life. And following Lori, we're going to have Lisa Bonanno from Nevada, and who will share her story about Medicaid providing life-saving treatment for stage 4 lung cancer and bridging her until she qualified for Medicare. Thank you. And so, Lori, over to you. Thank you. Thank you for being here.
Good morning. My name is Lori Burgess-Jett. I am from just outside of Cleveland, Ohio, and I'm a proud Clevelander. In October of 2015, I lost my job after a corporate downsize. At the time, I was the sole provider for 3 young children and myself. I have a son who's on the autism spectrum, and he needs treatment, so I didn't want to lose his critical care. So I quickly signed up for Medicaid coverage to protect my children. When I applied, I was told that I was also eligible for Medicaid because Ohio had expanded Medicaid for adults up to 138% of the federal poverty level. I thought, I'm not going to need that. I've never been sick. I'm healthy, right? 2 months after I lost my job, I noticed a hardening in my left breast. I was diagnosed with stage 3B breast cancer, and doctors told me that I would need to be in treatment for a minimum of 18 months. I did take the Medicaid expansion. Given how rigorous and frequent my treatment would be, my oncologist urged me to suspend my job search until I got through my treatment. I went through 16 rounds of chemotherapy for 6 months, a bilateral mastectomy, 33 rounds of radiation, 3 additional hospital visitations, and another surgery because of infections, and I was on oral chemotherapy for 6 months. I just finished in March. Having access to Medicaid saved my life. I don't know what I would have done without it. I could never have afforded the treatments that were required to fight my cancer. I did get married last month in Colorado. A lot of Colorado here. And right, it is a beautiful state. I got married last month, and as a result, I'll soon have access to my spouse's employer-sponsored coverage. But Medicaid was a critical bridge for me. They gave me coverage and saw me through my diagnosis and my active treatment. My children still have their mother. Some days they're excited about that, some days they aren't. And thanks to my treatment, I'm hopeful I'm going to be around to watch them grow up. Isn't that what we all want? I'm grateful that John Kasich, my Republican governor, and many other governors across the country recognize the importance of having safety net coverage available for their hardworking citizens who, through no fault of their own, lose a job or get sick. But I can't imagine any state's going to have the funding needed to pick up the slack if the federal funding for Medicaid is cut the way that it's proposed. Without adequate funding, the number of eligible people will be cut and coverage will be scaled back. Because I will always have follow-up. Anybody that's ever had cancer knows that that's the reality. Cancer never ends. I'm terrified that proposed changes to the healthcare law could also mean that I could lose coverage or be unable to find coverage that I can afford down the road. And as Matt had mentioned, the lifetime caps issue is also in play. My treatment worked because I followed the recommendations and timelines for treatment protocols that my oncologist prescribed for me. But if I'm forced to pay more out of pocket, I may have to delay any future care to balance other household bills. No one should have to battle life-threatening disease with the anxiety of losing or not having affordable health insurance options. We all deserve a chance to live. My children deserve to have their mother beside them as they grow up. I hope the senators, including my own senators, Sherrod Brown and Senator Rob Portman, will consider the proposed changes and really think this through to ensure that whatever they enact will not force patients to compromise their care or face financial ruin in order to access the recommended treatment just to stay alive. Thank you.
Hi there. My name's Lisa Bonanno, and I live in Henderson, Nevada, with my husband and my 17-year-old daughter. I've been surviving stage 4 lung cancer for 5.5 years. I'm honored to be here today as a volunteer from the American Lung Association and to share my story about why Medicaid is so important and why the Senate should stop this health care bill. After being a bartender in Las Vegas for 17 years, at the age of 38, I decided to go back to college to make a better, secure future for my family. After graduating in 2011, I decided to go back east and visit with my family before starting my new career. I had already been having back pain for several months, but while we were visiting Graceland, the pain just continued and got so severe that I called my mom crying at home, and the next day, as soon as I got home, we decided I needed to go see my doctor. And after multiple tests, I was given the diagnosis of stage 4 lung cancer. Not only was I extremely shocked and devastated by this diagnosis, but I was also worried because I didn't have health insurance. My first thought, of course, is that I still need to be here to finish raising my kids. At the time, they were 19 and 11 years old. Being faced with your mortality at such a young age creates so many emotions and fears about your future and lack of. So not only was I worried that I had to fight the deadliest cancer in the United States, but I was also wondering how I was ever going to pay for my treatments without health insurance. No one should have to worry about affordable health care when you are fighting every day just to live. I was immediately admitted to the hospital to have a surgery on my spine, and the social worker started the process for me to get coverage through Medicaid. In the first 1.5 years of my diagnosis alone, I had 6 rounds of chemotherapy, I had 10 rounds of radiation to my bones, and 3 surgeries, which totaled approximately 30 days in the hospital, all of which was covered by Medicaid. I can honestly say I know I would not be here standing today if I did not have medical coverage that allowed me to get the treatments and care that I needed. Medicaid kept me covered for the next 2 years until I was able to qualify for Medicare. I've come to Washington multiple times to mainly ask for more research funding to the National Institutes of Health, but today is one of my most important visits I've ever made. To me, without health care, NIH funding really doesn't matter. I always say that I'm still here today because of research, but the fact is, without insurance coverage, all the research in the world cannot extend my life. And that's why I'm here today, to make Senator Heller and other senators understand that Medicaid is literally a life and death situation for millions of Americans. Every single one of us in some way is touched by cancer or lung disease or heart disease, and we are here to ask them to vote no on the Senate health care bill because every American deserves quality and affordable health care. No one should die because they do not have health coverage. Because I had health coverage through Medicaid, and because of all the recent advancements for lung cancer research, I've been on a targeted drug therapy that has kept my disease stable for over 4 years. And it is my hope that the Senate will hear and learn from my stories, and please keep this in mind when they are voting this week. Thank you.
So Lisa, thank you very much for your words. Lori, thank you. Matt, thank you. What you've heard from the patients, and we have a lot more patients out there with these stories. This is what makes it real. I also thank the senators for joining us today. We had other senators that wanted to join and couldn't do it because of the Senate schedule. But the fact of the matter is, this is what we're dealing with. You people are examples of why this is real. This is not theory. We've had people that came in for this week from as far away as Alaska, and I don't know how many of you have made that flight, but that's a long flight. Flights, plural. We're all counting on Congress to protect patients now, and we thank you so much for being part of this. This is something that we can't fail on, and thank you so much for being part of this. Thank you. And if there are any questions that anybody has, any members of the media would be happy to entertain them at this time. Thank you.